Thank you all very much. Helene Gayle has dedicated her career to making sure that the building blocks of healthy, secure lives are available not only just to citizens of wealthy nations, but to people everywhere. As a doctor and a public health expert, she has significantly advanced the global fight against AIDS. She's championed the critical issue of health, particularly women's health, and she's made CARE, a great organization, even greater. In fact, when I became Secretary of State, one of the very first people I reached out to was Helene. And I said, Helene, do you have any interest in joining the administration? And she said, well, of course, I'm very excited about what can be done, but I care about CARE, and I'm committed to CARE. And I know a little bit about her tenacity as well. Now, as I look around this great space here, I see friends and colleagues, and I know that there are representatives from so many backgrounds and walks of life, from governments, from NGOs, from academia, even the NBA. And I know whatever vocation has brought you here, whatever path you've traveled, we all have something in common. We've come together for the CARE annual conference because we care. We care not only about an organization that is so aptly named, but we care about the mission. And Bo read that mission statement at the very beginning. We care about defending dignity and fighting poverty. And we care about people who work from sunup to sundown to secure the basics of a healthy life, about the repercussions of a global economic system that traps more than 1 billion people in poverty, most of them women and children, about the future of families and communities in the aftermath of natural disasters that in one instant can erase years, even decades of progress. But as you know so well, caring alone is not enough. I wish it were. I wish it were so self-evident that all we had to do is to say to one another, well, we care about this, and action would somehow burst forth. But we need to be the actors. We need to channel our care into concrete actions, something that all of you do every single day. CARE's mission to tackle the underlying causes of poverty so people can lead lives of dignity and self-sufficiency is very close to my heart. And it's a mission that we share in the Obama administration and especially at the State Department and USAID. Because like CARE, we believe that by creating the conditions in which families and communities thrive, we can promote stability, opportunity, and progress far beyond any one community and even one country. And we can foster a new set of capable partners to help us meet global threats, from climate change to nuclear nonproliferation to terrorism. And as we elevate development as a critical pillar of U.S. foreign policy and national security, right up there with diplomacy and defense, we're taking a new approach. We're supporting local and national leaders who are already driving progress and who can, with our help, improve and accelerate their work. Because our goal is to help our partners, partner countries, partner organizations, partner individuals, build their own capacity to provide citizens with the essentials like food, water, healthcare, education, economic opportunity, jobs, credit, responsive, accountable public institutions. So to that end, we're investing in innovation, and we're supporting entrepreneurs, both business and social entrepreneurs, who are putting their talents to work to address the unmet needs that they see. We're designing programs with women in mind and increasing opportunities for women to lead because, as the people of CARE know so well, women are powerful. We're using our convening power to bring together governments, businesses, foundations, NGOs, universities, all of which offer valuable and complementary expertise and resources. And we're reaching out more than ever to the private sector to get their assistance and ideas, because we're committed to getting results, not measured in dollars, but in lasting changes in people's lives. Now, I could discuss many issues with you today that showcase this new approach to development, but I'm going to focus on one that holds a special urgency and does represent a new strategy that we are employing, namely nutrition. Few issues provide a more direct, affordable, and effective way to save and improve lives. But as experts on nutrition will attest, it has long been overlooked by a global community focused on other priorities, because there are so many priorities that capture our hearts, that really speak to us. As governments and organizations search for strategic interventions in the fight against poverty, places where our money and our effort can make the biggest and most lasting differences, nutrition represents a ripe opportunity, and one that can be addressed from many different angles. For example, in Kenya, as Mrs. Odinga knows, women scientists are developing biofortified crops. Women scientists whom I have met with, who are out in the fields representing the fact that more than 60% of all the farmers in Kenya, just like more than 60% of the farmers in Africa, are women. So these women scientists and researchers are going to farmers, mostly women, helping them increase their harvests even in times of drought, to be able to grow more nutritious food for their family, to increase their productivity, to have more at the marketplace. At a clinic in South Africa, community health workers offer comprehensive care, including nutrition to people with HIV and AIDS. In a neighborhood in Jakarta, new mothers can have their infants weighed and measured to make sure they are growing as they should. And here at home, more than 30 million American children receive free or reduced priced meals at school. And for many, that's their only reliable source of good nutrition. And in the face of an obesity crisis that could lead to this generation of American children becoming the first in history with shorter lifespans than their parents, advocates, including First Lady Michelle Obama, are leading the charge for healthier food both in school and at home. Now, whether the primary focus of these programs is agriculture, health, or education, nutrition is the common thread, because it's an issue that cuts across every sector. It's an economic issue. The World Bank estimates that up to 3% of gross domestic product is lost to undernutrition in the hardest hit countries. And undernutrition costs individuals more than 10% of their lifetime earnings. It's an education issue. Undernourished children struggle to learn and to stay in school. And it is, of course, a health issue. 1 in 3 children worldwide suffers from undernutrition. In some countries, half of all children are stunted, which impedes their brain development and causes lifelong health and learning problems. More than 3 million children and 100,000 mothers die every year from causes related to undernutrition, which weakens immune systems, makes people susceptible to other health problems, such as anemia, which is a leading contributor of maternal mortality, and pneumonia, which is the leading cause of death for children worldwide. Undernutrition impairs the effectiveness of life-saving medications, including the antiretrovirals needed by people living with HIV and AIDS. And the effects of undernutrition linger for generations. Girls stunted by undernutrition grow up to be women who are more likely to endure, if they survive, difficult pregnancies. And then their children, too, come into life undernourished.